Hi, everyone. This is Rachel over here. I'm just waiting a little bit for everybody to come on. I'm so excited to be able to share this class with you. So I'm just waiting a little bit, but my name is Rachel. This is our childbirth preparation course. I know that we have a few people that are coming on, but my name is Rachel. I am a maternity nurse. I'm also a lactation counselor, and I love doing this course. It's a wonderful way that we can be able to prepare a little bit for childbirth, learn what to expect when the baby comes, and just have an overall awesome experience, both in pregnancy and childbirth. So for those of you who signed up, I have 8 steps to prepare to childbirth PowerPoints that you guys should also have access to. If you don't, you can always email me at mommydidyouknow@gmail.com. That's mommydidyouknow@gmail.com. And I will be able to send it to you as well. So to start off, my name is Rachel, like you mentioned. I'm from Florida. I have 2 kids, so maybe we can just do a really quick introduction. You can say who you are and where you're from. And if you're pregnant, you can say, how many weeks you are. Or if you have a young one at home, you can say, how many you have, maybe how old they are. So I have a 5-year-old and I have a 3-year-old. So it's been an experience having 2 toddlers, but I absolutely love having boys. I'm a boy mom. Mateo and Nathan, those are my kids. So, but I look forward to hearing from all of you guys. So the beauty of this course, and I try to make it very interactive as well. So feel free to use the chat as much as you want. That's a great way that we all can learn from each other, get to know each other, and form a community, because that's what we are as moms. We love having communities. So hi, Marlene. So nice to meet you. I see you're from Atlanta, Georgia. I do have family in Atlanta, so it's beautiful over there. We went, it was like it was a huge aquarium that we went to in Atlanta. And then Vicky from NYC, from New York, due June 3rd. So you're coming up. So I'm excited to be able to hear from everybody as we progress through this course. So this is my prepared childbirth story. So one thing I realized as I was making this course is that a lot of families feel overwhelmed when it comes to all of the prenatal education that's available to you. I'll see that you want to learn about taking care of yourself, but you're hearing stuff from 8 different sources and it becomes very overwhelming. And then especially because everybody has different things that, different goals for your pregnancy and different situations. So what worked for your friends or your loved ones might not work for you, and that's okay. That's why everybody's different and it makes it beautiful. So I started this basically because my first experience with delivery was not that fantastic. Although I was a nurse with my first baby, Mateo, he's 5 years old now. I was a nurse at that time, but I didn't really know that much about breastfeeding or childbirth. I thought I did, but there's certain things that you don't really learn from a book. And I tell my clients this sometimes too, it's like, even if babies had a book, they wouldn't follow it. Like even if there was a manual, like, okay, here's the manual for baby care, they definitely would not follow it, just because babies always have their own schedule, their own guidelines, and that's fine. So I always tell moms, look at yourself. What are your goals? And then work towards that. So with me, I thought I knew about pregnancy. I thought I knew a lot about labor and delivery. But then with my first baby, I didn't really know how to manage my pain. I didn't know how to progress through labor. I was in labor for like 18 hours, literally 18 hours. I had to also push for like 2 hours because I didn't really know how to be effective at it. So I figured that this would be great to go over my experiences and how hopefully you guys can avoid some of the mistakes that I made with my first one. And then also with my first, I dealt a lot with breastfeeding issues. Everything under the sun with breastfeeding complications, I was there. I had the sore nipples, the bleeding nipples. My baby was not latched on correctly. My baby was not eating right. He was under phototherapy. I dealt with mastitis, engorgement, dehydration. So that's why I became a lactation nurse. I decided, okay, With my second baby, I want it to be completely different. I don't want to have that same experience. I don't want to be in labor for 18 hours. I don't want to be pushing for 2 hours. I don't want to have gel pads as the only way of putting on a shirt because it was so painful after I had my baby. So I became lactation nurse. I did so much education, and I'm so proud of where I am today with my second baby. It was a complete different experience. I was in labor like 5 hours. I literally pushed once. It was funny because it was even, it was during practice pushes. Like we were just in my head, I'm like, all right, we're going to do a little practice push. He's like 1, 2, 3, push. I'm like, okay, I'm focused. I'm about to push for the next time, like in my head, thinking to push again. And then the doctor's like, oh, what do you know? The baby's already here. I'm like, oh, wow. So there was big differences. Breastfeeding was much, much different, practically painless. The jaundice went away one day. With my first one, we dealt with it for a week. With my second, we literally one day he was out, he was gone with the phototherapy. So it makes a big, big difference to have education. So I just want to applaud you guys. I know now, like we're officially having some people now logging on, but I just want to applaud you guys for taking the initiative to focus on your prenatal education. So many people, they're always looking at their prenatal care as just the medical aspect of prenatal education, or the medical care of their prenatal care, but education makes a huge, huge difference. So we also have Adrienne from Michigan with her first baby, but she's going to be induced in April. So it's coming up. It's like almost a week, basically. And Jasmine, hi, Jasmine. It is so nice to meet you. So as we progress through here, I have different steps to help kind of organize the material in this course. So the first few steps are going to be talking about pregnancy. The first step that I always tell my patients is to learn about your body, learn about how your body changes through pregnancy. What are things to be expected and what are complications? A lot of the times people might know what to be expected from, as they're progressing through pregnancy. They know about the morning sickness, they know about sciatica, but when they end up with preterm labor, they don't know what to do. When they end up with preeclampsia, they don't know what to do. So it's so important to know about the, to be expected, learn about the morning sickness. For you guys that are on now, what are some remedies that you guys have used for morning sickness? I know, like for me, I dealt with morning sickness a lot, especially with my first baby. But I noticed that diet changes were big for me, or even recognizing when to eat, because I noticed that I was less nauseous during different times of the day. So I'm curious to see what you guys have done for morning sickness. And we do have Jessica on here, also first-time mom. She's for a natural unmedicated birth due in May. And this is great. I love being able to have all these different people from different states, different communities, and different goals. And that's the beauty of it, is that in the end, we're all moms. We want the best for each other, and we all have different goals. So the key really is understanding what is to be expected, complications that you might face, and how you in particular, you specifically, I'm big on family-centered care, you specifically, what you would do to overcome certain barriers so that you can reach your specific goals. So we have Jessica saying crackers, potatoes, ginger tea. I love the ginger tea too. When I was nauseous, what I did was, and I do it in the hospital too, is I'll actually take ginger ale, because, if you don't have ginger tea, but, you have other stuff, what I'll do is I'll actually take ginger ale. And nurses do it all the time. We say that it's a secret recipe, but it's not a secret recipe. We just take ginger ale, you put it in the microwave for a minute, and then you put your favorite tea bag inside, and what do you know? It's ginger tea, and it's super easy, and it really works. And it even helps with gas pain too. Sometimes I'll give it to my patients that have gas pain, or even sometimes for my C-section mommies who are having a hard time peeing. Sometimes I'll give them a few of those, and I'll tell them, hey, drink 2 cups of these. And sometimes it helps them pee after childbirth as well. So the ginger tea, Jessica, was great. Sips of ice water is very good too. Some people even need to chew on the ice. So like for me, I love chewing on ice too. So we have over here some different things to be expected. We have morning sickness, frequent urination, fatigue. Heartburn, what really helps with heartburn is try to avoid those greasy foods. Try to also exercise helps as well. Sleeping well, or even keeping yourself upright after you eat can help with the heartburn. Sciatica. Now, sciatica is kind of like a sharp pain that happens as there's a lot of tension on your body. So it's kind of like a sharp pain throughout your hips. It can even go from like almost to your feet all the way up sometimes. I remember I would have really bad sciatica with my second baby. So sometimes keep in mind that sciatica, you might not have it with your first, but you might have it with your second, especially as, you know, your body has gone through some things. So with sciatica, what really helps is a nice abdominal support band. If you can have one around the hips and the abdomen, that is great too. It can help you. They even have some that are for both prenatal and postpartum care. So that's fantastic. We also have emotional symptoms, insomnia is to be expected. Now, complications, I always want to go over complications during pregnancy. It's like I mentioned before, a lot of people, they deal with the commons, but they don't really deal with the complications, you know, and I think that's important because like to be expected, understanding how to deal with that is important and it will make you more comfortable. But to understand the complications can save lives, really. I mean, it can save your life and it can save the baby's life. So some complications that you would want to research in. And by the way, I do have on mommydidyouknow.com, I have a whole bunch of different programs. Some of them are completely online, they're self-paced. I have all others that are consultations completely live. I have some that either are also mixed in live as well. So I have something for everybody. And I go through these all in depth. And I'm going to go over some of the resources for you guys as well. But complications, preeclampsia, it's so important to understand what preeclampsia is. Who can tell me what is preeclampsia? So it's a complication that all mommies should know what it is and also what to do to manage it. And then even some complications if preeclampsia is left unmanaged, what might happen to you, what might happen to the baby, especially to see some signs to look out for. And give you a hint, preeclampsia, a lot of people might get that mixed up with high blood sugar, but preeclampsia is actually high blood pressure. So preeclampsia sometimes as the increased demands, and exactly, so Jessica was right, hypertension due to pregnancy is preeclampsia. So what happens is there's increased demands on the body, there's increased fluid in the body, there's also all the hormones going like crazy. So sometimes your blood pressure will be higher when you are pregnant or even after you deliver. And then that's great. You're right. Changes in diet, if necessary, that can help with preeclampsia, trying to lower your salt intake. Even sometimes they might have fluid restrictions. So normal blood pressure, they say anything over 140 systolic and over 90 diastolic is considered preeclampsia or even pre-hypertensive. So 140 is the top number and 90 is the bottom number. If it's over that, that is considered we will pretty much be looking in to start managing your blood pressure. If it's between the top numbers, between like 130 to 140, we're keeping an eye on it. Usually we'll say, okay, you know, she's a little maybe pre-hypertensive, but usually they might not have treatment for that. Between like 130 and 140. If it's over 140, that's when we start having treatment. When it starts getting like 160s, that's when we start going into like IV medications and kind of really making sure to get it under control, because that's when you can start getting the seizures. And if you're pregnant, you can even have something where the placenta just detaches itself from the uterus because of the increased constriction of the blood vessels. So, so exactly all of those are correct. We have changes in diet, low sodium intake, trying to have fluid restriction as well, which can be important to know as well, because sometimes we know when you're pregnant, you need to drink water, but you have to have, if you have preeclampsia. So normally that is treated with diet medication. And then some complications of preeclampsia for mom. One are the really big one, you know, like seizures and things like that. But another one that a lot of people don't realize is that because there's more constriction of the blood vessels, there is kind of limited blood flow to the baby through the placenta, because obviously those your arteries and your veins are more constricted, especially your arteries. So what ends up happening, because there's more constriction, there's restricted blood flow going to the baby, sometimes the babies can be smaller. So you'll have a baby that's low birth weight, or sometimes even you might end up with complications when you are in labor, that the heart rate starts to drop because of the loss of oxygen. So that's why sometimes if you are preeclamptic or even pre-hypertensive sometimes, but not exactly preeclamptic, they might even have you do something called a non-stress test, where you come in and they'll measure the baby, they'll measure the heart rate, see to make sure that the baby's okay. Especially if you are contracting every now and then, they want to make sure that with the contractions that the heart rate does not go down. That's called a late deceleration, if you ever hear those. Then another complication I want to talk about is gestational diabetes. So gestational diabetes is a high blood sugar when you are pregnant. So that is usually regulated with diet. So you want to stay away from your carbohydrates, stay away from your sugars, and drink a lot of water. Now, the biggest complication with gestational diabetes, or I would say most common complication with gestational diabetes, is that you'll have a bigger baby, so large for gestational age. So you'll have a baby that's getting all of this glucose, they're getting ready, you know, they're getting used to all of this, their body's regulated, maintained with all these glucose. So you'll have a big baby. Then when the baby is born, what can end up happening is you'll have something called a hypoglycemic baby, which means that the blood sugar drops after delivery. So if you think about it, think of it this way: your baby in delivery, your baby in the uterus has been completely supplied with all of this sugar, with all of this glucose. Then all of a sudden, the baby's out and is not supplied with all of this constant glucose like what the baby was supplied with their whole life. So sometimes it takes some time for that baby's sugar to start to regulate. So if you are especially a breastfeeding mom and your baby has, if you want to be a breastfeeding mom and you have gestational diabetes, you want to make sure that your baby nurses as early as possible, and that you try to do skin to skin as well, because what happens is sometimes if the babies are cold, they might start breaking down their blood sugar, because babies don't shiver like adults, they break down their blood sugar. So if they're breaking down their blood sugar and they're already having, you know, not as much sugar as before, they're going to end up with hypoglycemia. And then if it gets very, very urgent, that's when you might have to use supplementation and things like that. So to try to avoid that, try to nurse early, try to nurse frequently, and try to nurse also effectively and skin to skin as much as you can. So those are just kind of little tidbits to help you along the way. So hopefully you can understand how understanding the complications can help to avoid all of these barriers that you might face after you deliver. Now we have a little case study. So for these case studies, I'm going to use them as a way to test your knowledge. So these are just questions that either I had, or experiences that either I had or that mommies have asked me. So sometimes I'll have moms that come to me and say, hey, what should I do about this? Or, you know, hey, I learned about this. So what the case studies is going to do is we're going to have a question or a scenario, and you guys will tell me what you will tell the specific mom, or what would you do in this situation. So for me, I had my experience with hyperemesis. So I would want to ask you guys, if you were suffering from hyperemesis or you were suffering from nausea, we mentioned a few things what to do, but what would you guys do to combat hyperemesis, or what would you guys do to combat nausea? So we just had, I think we had one person give a few of her recommendations, but I want to know what you guys think. So if you are nauseous, what are some things that you would do to combat the hyperemesis? And not only to prevent it, but also to help your body as you have hyperemesis. You're obviously going to be vomiting a lot. So what would you guys do? And I'll be giving you some time to answer that as well. And you guys can type it, and it's a great way that we can learn from each other. So a few things that I would definitely keep in mind if you are battling with hyperemesis or someone that you know is battling with hyperemesis is number one, to try to stay hydrated. I would definitely tell my clients that, or I try to tell myself that as well, is try to stay hydrated. So drink water if you don't like water, whatever other fluid, if you have, you want water with a taste in it, have an infuser, if sometimes even for me, I had to like suck on a lemon even, like I had to have water with a little bit of lemon inside, and that really helped. And then Jasmine said sipping water works for me, but I didn't have that issue. So that was good. For those of you who don't have to deal with it, oh, you are so lucky. I remember there was a time where the only thing I was able to have were pickles and water. Like literally the only thing I was able to have. And what helped me were salty foods. So just be careful if you are obviously if you have any hypertensive issue or anything like that, you want to keep an eye on that. But what helped me were lemons too. So I remember when I worked night shift with my first baby and I dealt a lot with nausea, I had to like suck on a lemon and as I was giving a report. And that was the only way that I was able to kind of keep my nausea at bay. Now we have step number 2 is don't neglect mental preparation. So that's so important. So we talked about step number 1 was talking about what to expect during pregnancy and knowing some of the complications. Step number 2 is to prepare yourself mentally. Now, this is really important to keep negative people kind of at bay. Of course, you really have to play by ear. You can't like cut off people from your life, but be honest with them. And yes, tangerine helps. Eat every 2 hours. So that's a really, really great tip, is to eat frequently. So sometimes people need to eat frequently to keep the nausea at bay. So you guys are fantastic, right on point there. So we have, remember the power of your words. I don't know how many times I'll come into a patient's room and it's like they're holding their baby and they're just like shaking their head like this. No, like they can't do it, or they're going through an experience and they're overwhelmed. But remember the power of your words and your body language. So try to say, yes, positive affirmations. Yes, I can do this. Yes, I was made for this. Breastfeeding is natural. My baby is perfect. I'm going through this pregnancy perfect. All of these different things. Remember your words, remember your body language. Open body language also makes a big difference when you're talking about things too. Because sometimes when you talk to somebody and you're talking like this and your arms are folded like this, it kind of makes a more depressing tone. But then if you have more open body language, that can help as well. And a smile goes a long way. And then don't neglect what gives you joy. If you love music, listen to music. If you go to church, keep going to church. If you're a member of a book club, keep reading those books. Whatever you are doing that gives you joy, try to continue doing that, because that's what's going to be able to, keep you going in the end as well. And then keep your support system close. So all of these are different ways to prepare. So in terms of preparation, so this is a scenario here where I have somebody who was afraid of being a first-time mom. So I want you guys to tell me, what are some things that you would tell first-time moms to kind of help them prepare mentally for what is to come with their pregnancy? I can even make this a little bigger too. There we go. So I have a lot of first-time moms and first-time moms here. So what advice would you give first-time moms that are coming in for their baby? For me, as you can see, I deal a lot with positivity, positive words, positive mindset, preparation. Those are the keys for first-time moms. So in the case of, I had my friend named Jocelyn who came to me that she was like, I just feel overwhelmed being a first-time mom. What should I do? So what I normally recommend is, positive thinking, positive thoughts. And also not to overthink it. Now that's a huge thing, is I'll see a lot of first-time moms, they overthink everything, every little detail. Like, if I do this, 6 minutes instead of 7 minutes, will that make a big difference? Don't overthink things. So these are my recommendations for first-time moms for preparation wise, is stay positive, don't overthink things, keep your support system close, and, keep up with this preparation, this knowledge base, this education, it goes a long, long way. Now, step 3, how the body progresses through childbirth. Now, this is the part of the class where everybody is most excited about. You're like, all right, I know about pregnancy. Let's talk about the nitty gritty childbirth, which is important as well, but it's important to go over your pregnancy as well. So for your pregnancy, to be expected as you progress through labor. So finally, you've gone through pregnancy, you've gone through your lab work, you've gone through your prenatal visits. Now you're like, all right, finally, I'm going in pretty soon. Or, we have some people that are about a week away. What should I be looking for in terms of labor signs? How do I know if I'm going through labor, if I'm going through false labor, which a lot of people ask me all the time. Now, to be expected, lightning, that's when pretty much all of a sudden you'll feel a lightning as the baby starts moving down the vaginal canal, especially when it starts engaging in the pelvis. Sometimes you might feel lightning kind of move all the way up and shooting all the way up you. That's definitely a sign of labor as the baby starts engaging. Bloody show or even a mucus plug, but keep in mind that you don't necessarily need to have any of these in order to be in labor. So sometimes all of these kind of happen progressively through. Some people might have lightning, but no bloody show. Some people have the mucus plug right before going into transition. So everybody's different. So bloody show, mucus plug, water breaking, although keep in mind too, some people, their water breaks some people, their water breaks and they're not even in labor. And some people, their water breaks and it's like right before labor, or even very rarely, their baby is delivered still inside the amniotic sac, which is very interesting. It's rare, but it's happened as well. So like I said, these are signs of labor, but does not necessarily mean that you will go through each and of these steps. Usually you'll start dropping as the baby gets closer to delivery, especially as the baby starts engaging. You might start feeling some lightning. Keep in mind too that your baby might not be moving as much towards the as you get closer to deliver as well, just because there's less space for the baby to move. So let's say in the second trimester, you were feeling the baby move like crazy. Then all of a sudden you're in your third trimester, you're getting ready to deliver and you're like, man, the baby's not moving at all. What's going on? It could just be that the baby has engaged in the pelvis and now there's just not enough room to move. But you would want to have try your kick counts as well, which you usually try to do after you eat. So like after you eat, you can sit down, you'll put your hand on top of your belly and feel for about an hour. Now, normally I say you would want to have about 10 movements during that time. It doesn't have to be big ones, especially as the baby's getting closer to delivery. You might not feel the movements as much, but usually you'll try to eat first, because that's a big thing. Some people, they'll try to do their kick counts like after they've eaten, hours ago, but you would want to try to eat first, get that baby moving, and then see what happens from there. So we also have nesting to be expected as we get closer to delivery. That's when all of a sudden you're like, man, I just got to get the nursery ready. I got to get the room ready. The crib, I have to get set up. I have to start organizing everything by age. I was there too, where before both of my kids, I started organizing the whole drawer. I was like, this is newborn. This is 0 to 3. This is, who else has done that? I'm sure a bunch of you guys have probably done that as well. But I'm like, all right, I'm going to organize every single drawer according to age. Then once the baby comes, it's like, whatever fits, you just find whatever you get. So to be expected before you go through labor, well, as you're going through labor also. Now here is the key. And then, Jessica's like, me. So don't worry, you're not the only person here. Everybody goes through that nesting where all of a sudden you have to color coordinate things. You have to put everything into little piles, like, all right, this is going to be in the hospital bag. And I was one of those persons where I'm like, all right, I'm going to put everybody in individual little baggies that I'm going to have. This is for the first day. This is for the second day. That doesn't really last too long though as a new mom, but everybody goes through that. And then as you get closer to delivery, let's say your baby's moving down, you're like, oh man, I think I'm getting closer. My belly has dropped. Now you might start contractions. You might start feeling contractions. Now the difference between regular contractions and Braxton Hicks. So Braxton Hicks are kind of like false labor, or you can even say them like practice contractions if you don't want to say like false labor, because you're like, oh man, false labor, what is going on? So some people prefer to call them practice contractions. So with those practice contractions versus regular contractions, true labor, for one, does not go away with hydration and resting. So with Braxton Hicks, for example, you'll drink some fluid, you'll put your foot up, and all of a sudden you're like, oh, okay, it's better. Now let's say you try that and it does not go away. Now you'll time it. If it's regular, whether it's 15 minutes regular, 30 minutes regular, but it's regular, that's when you're like, all right, it's regular. That means I need to, start thinking, make arrangements, call, whoever is going to be taking care of the kids, hey, and I had to do it with my second. I'm like, hey mom, and I went into labor at like 3 o'clock in the morning. Hey mom, you need to come over right now. I know it's 3 o'clock in the morning, but I'm pretty sure I'm in labor. Then you want to start making the arrangements, especially as you start getting, closer. So regular contractions are true labor contractions are regular, and they're also intense. They don't go away with resting. They don't go away with fluids. And then also they're more moderate to heavy in their feel. So if you feel your forehead, so like, I want everybody to feel your forehead through this screen. So you feel your forehead over here. It's really hard and it doesn't really have a lot of mushiness to it. That would be like a heavy or a hard contraction. Okay, then you'll feel that. So that is a hard contraction. Like, oh man, I really feel like I'm contracting. Your belly will feel like that. Now, if you feel your nose and you feel your chin, okay. Now you feel your chin, it's very, it's very bubbly. It's very soft. That would be like a mild one. You feel your nose, let's say it's bubbly, but kind of tight. That might be a moderate one where it's, not that soft, but, it's just a little tight. Then with the hard one, so that's what you want to focus on is, oh man, it feels like my forehead here, that's heavy. So that's one way that you can kind of tell. Then as you start getting closer, you get that ring of fire. You get the, oh man, I start having to poop kind of feeling. Now some complications through labor. One is abnormal heart rate. So abnormal heart rate is, let's say you're going through delivery, there might be a cord around the neck, there might be some oxygen that's not being delivered to the baby for whatever reason. It could be a placental insufficiency, whatever it might be, something is causing that baby's heart rate to drop. When that happens, they'll usually turn you on your side, usually their left side. If that doesn't work, maybe your right side. They might try to stop the Pitocin, especially because if the Pitocin is going too rapidly, sometimes it might cause contractions to go back to back to back. And every time a contraction happens, your blood flow kind of decreases a little bit, the blood flow to the baby. So as those contractions are happening back to back to back to back, it can be causing the baby to have some issues in terms of trying to, keep up with it. So they might stop the Pitocin if you're going through Pitocin. If you are also having a lot of pain, sometimes they might try to help with your pain a little bit if you're too stressed out, because what happens is, if you think about it, the oxygen that you're taking in is not just for pain management, but it's for the baby. So if you're not taking in enough oxygen, you're not really giving the baby enough of a buffer. So sometimes they'll help you move to the side. They might stop the Pitocin. They might try to take care of your pain. And then they also might, there's so many different things, but they might also give you some oxygen. What the oxygen does is it's not necessarily for you. Your oxygen levels might be fine, but it's to give the baby a little bit of a buffer so that when that contraction happens, that baby's oxygen does not drop to the floor. So that's what they're looking for. Lacerations. Now, lacerations, the best way to avoid it is for number one, to try to make sure that if you're pushing, it's actually time to push, that the baby is low, that you don't push when you don't really feel the urge to push. And there's different pushing techniques and different pain management techniques as well. And we can go over all of them when we go through the pain management as well. But best way is just, push when it's actually ready to push, and make sure that you're not pushing with your vaginal area as well. So some people, when they're pushing, they have a technique where they kind of push through the vaginal area, but you would want to push even more with your abdomen as well, or even from here to your pelvic area. And then not doing that vaginal pushing can help with decreasing laceration. Sometimes they even put like a little oil on there to help it out. And then sometimes there's not much you can do. Now for laceration versus episiotomy, everybody's different. Everybody has different choices for that. Some people, they prefer to have an episiotomy. Some people prefer to have laceration and tear naturally. It completely depends. I had a 1st degree natural tear with both of my kids. I can say lacerations, they do hurt less than episiotomies. However, episiotomies have a quicker repair time. So those are just kind of pluses and minuses to balance out whatever your specific goals might be. Episiotomies, they usually hurt more than natural tearing, but they do recover faster. So it's just a matter, if you have an episiotomy, try to have like a SIDS bath, try to have dermoclast spray, tux pads, all those different things can really help you out. Then there's other complications, failure to progress, especially if you're in a lot of stress. Sometimes you'll have a hard time progressing. And Jasmine, a laceration is a vaginal tear. So your vaginal tear can be a superficial one, and it can even be going all the way. It could be a little superficial one, a little vaginal tear, a little periurethral tear, could be a little labial tear, all the way down to, oh man, you went all the way from the vaginal area to the anus, to the rectum. So the amount of tear is different, depends on the person, and there's no way to kind of know exactly how you're going to tear until it kind of happens. Sometimes you're like, okay, this person's going to be completely intact, and then it ends up having a 3rd degree or 4th degree. You can't really tell, but there are certain things that you can do to avoid it, or reduce your risk of having them anyways. Then we have other complications, shoulder dystocia. That's if the baby gets stuck coming down. Biggest thing is obviously you're not getting the oxygen coming towards the baby. I know, right? fun stuff you have to think about when you have a baby. Shoulder dystocia is one of the most scariest things as a labor and delivery nurse. It's when the baby gets stuck, the head comes out and the shoulders don't come out. So if that ever happens, you'll probably see a whole bunch of people run to you. It's usually a code as well. You'll have a bunch of people kind of press down on the pelvic area, try to release the pressure to get the baby out. In extreme cases, they might even have to break one of the clavicles in order to take the baby out. But that's like extreme cases. But in case you ever hear, shoulder dystocia or the baby's not coming out, they usually try to get it out within 30 to 45 seconds before, having any extreme treatments like that. But usually I'll see, just because you have the shoulder dystocia does not necessarily mean that you're going to have any major long-term issues. It's just normally they'll be watching the baby, make sure everything's okay. And then we have umbilical cord issues. Let's say the umbilical cord is wrapped around the neck. Both of my babies had a loose one that's usually able to be manually removed after the baby's born. Malpresentation, such as if the baby's feet first. So now we have the case study. So now you guys pretty much remember what we were talking about, case studies, where we're going to use what we learned to answer some questions that people have brought to my attention or had questions for me. So I had one client named Genesis who she kept asking me if she was in true labor or false labor. She was contracting, frequently, but she didn't know if it was true labor. What would you tell Genesis? So let's say you had someone call you up and you're like, hey, whatever your name is, Mary Jane, I think I'm in labor. How would I know if I'm in labor? Or even let's say all of a sudden you start contracting. How would you know if this is true labor versus just, hey, you're just practice contractions. And I'll give you some time to think about that. But there were a few different points between true labor and false labor. I have some carrots here. Regularity, that's a good one. I'll give you guys another minute, but a few different signs of true labor versus false labor. So true labor is regular and intense. Remember, the intensity would be like your forehead compared to like your nose or your chin, which is, you know, soft, maybe a little bit constricted. Forehead is much more severe. And then, everybody, you're like, oh, this is my first baby. I haven't even felt contractions yet. How do I know if it's true or false? Well, that is why I'm going over this. So at least you know. So true labor is usually intense. It's usually regular, and this is the key. It does not go away with water or fluids and resting. False labor usually goes away with all those things. And then it's important as well. So we talked about number one, we talked about understanding what is to be expected during pregnancy. We talked about how to prepare mentally for pregnancy, your new baby. We talked about also some signs of labor. Now, let's say you get to the hospital. It's so important to understand typical exams and treatments. You know, what will they be testing you, and what will happen if those tests are off for whatever reason. So many times as a nurse, I'll be, you know, helping a patient, and, you know, when I come in, I'm like, all right, you know, I'm going to draw some blood work for the baby. You know, they're like, okay. I'm like, oh, we're doing this test. We're doing this bilirubin test. Do you know what it's for? Oh, no, I'm not sure, but you can just do it. I'm like, no. If I was a mom and they were coming in to do tests on my baby, I want to know exactly what it's for. I want to know what the regular number is. I would want to know what would happen if the number is off. I would want to know how long would the treatment be for. And if you know what to expect before that, you know, that's why it's so important. Your rights as a patient, know your rights as a patient, as a mom. You have a right when you're getting exams done to say, hey, should I get these exams? Should I not? You know, or even, hey, what are these exams for? What will happen if these exams come back abnormal for whatever reason? So you have a right to ask for the tests, ask what your results are. So it's really important to be an active member of your healthcare team. Don't just be somebody like, here's my arm, you can take whatever blood you want. I think that's the vein. You know, I'm like, all right, so you know what vein to use for blood work, but you don't know what the test is for. You know, so it's really important, especially, you know, all these people that are coming in pretty soon that you will be delivering within the next week or so. You want to know what these are. So CBC, complete blood count. We're looking for your iron levels. We're looking for your white blood count, especially to see if you have any infection, indicators of infection, things like that. Rubella, if you're non-immune rubella, sometimes that can even cause, if you were to have rubella with pregnancy, can even cause miscarriage. So sometimes if you're non-immune, we can't give you the MMR during pregnancy, but we would want to give you the MMR vaccine after delivery. So you would want to have it after you have the baby, you know, if your MMR, and this is for maternal tests, not for baby tests, keep in mind. So rubella, if you're not immune, that's something that, you know, if you are taking vaccines, that you would want to stay on top of. HIV, if you're HIV positive, there's a lot of treatments for the baby, but you want to make sure that you have early intervention as soon as possible. So what normally happens if we have an HIV positive mom, the baby is normally bathed pretty much right away. Although normally we do like to bathe babies delayed. You know, we like to delay the bath a little bit, but if HIV positive moms, we normally do the bath as soon as we can. And then they normally have antivirals that are given actually right around birth for a certain amount of time. You'll usually follow up with an infectious disease doctor as well. And then the probability of your baby being protected from HIV is actually very high as long as you are good with your HIV medications during pregnancy, that the baby keeps up with those antiviral medications after delivery. Usually it's pretty good. The only thing is there's very few cases where breastfeeding is contraindicated or, not indicated, one of them being HIV. So if you do have HIV, it is not recommended to breastfeed. Hepatitis B, however, if you are hepatitis B positive, it is okay to breastfeed. It's a common misconception that you're not okay to breastfeed. Hepatitis B is transferred more than anything through blood. So if you're hepatitis B positive, you can still breastfeed as long as you do not have lesions or bleeding or blisters on your nipples. So if you are hepatitis B positive, it is so important to make sure that you know how to latch your baby correctly so that you can avoid those sore and blisters and bleedings on the nipple by having that correct latch, which we'll go over in the baby part. GBS, group beta strep, is a natural occurring bacteria that a lot of women have in the vaginal area. It's part of the vaginal flora. It's just group beta strep is fine for adults, but it can be very harmful for babies. So if you're GBS positive, make sure that you try to come to the hospital at early signs of labor to try to make sure that you have those antibiotics to cover you and the baby while you are in labor. And also, if let's say your water breaks, normally, even though your water breaks, you might still have time before delivering your baby. But if you're GBS positive, your baby's at an increased likelihood of infection. So if your water were to break, make sure to let your doctor know, because you don't want to wait too long if you're GBS positive. You want to try to have at least 2 doses of ampicillin or similar antibiotic to cover you and the baby. And that takes at least about, they'll usually want around 4 hours to 5 hours to at least get, that second dose in, but, the better, if you can't have more, but at least 2 doses of the antibiotic. RPR is syphilis. So usually if RPR is positive, we'll do an RPR on the baby. Drug screen, if drug screen's positive, really depends on what it is positive for. So like if THC positive, sometimes they'll say, okay, maybe you won't want to breastfeed, but of course, if it's like the harder stuff, cocaine and all of that craziness, we sometimes do special tests on the baby to make sure that the baby's not withdrawing, which is usually more of a behavior test. So just in case you're ever curious of what happens if we ever have a positive drug screen, which does happen, we normally just check the baby's behavior. We make sure the baby's not withdrawing. The baby is withdrawing, and then we have to do NICU admission to hopefully get the pain under control until the baby can get all of that out of the system. And if you are THC positive, which happens sometimes, what we do is normally you'll have a case management consult, possibly even a DCF consult. That does not mean that DCF will take the case. It's just part of the policy. But they'll go over the whole policy with you. I'm saying that also because of the more openness of THC use in like creams and hemp oils and things like that. There's not enough evidence to say that the THC from hemp oils, because I know for some people use it for like nausea and muscle soreness and things like that. They should not be used during pregnancy, but it's like there's not really much research either or, in their research, but they do say that if your THC is positive, not to breastfeed the baby. But it's just that's such a gray area in terms of things like that. PAH labs is if you're hypertensive, they might be checking your electrolyte levels, see how your liver's doing, all that good stuff. And then they'll be checking your vaginal exam, see how you're dilating, where the station of the baby is, softness of the cervix. When the baby is born, the tests all depend on the circumstance of the baby. So sepsis workup is an infection screen. Let's say your GBS is positive. Let's say you didn't have the antibiotics and your GBS was positive. They might have an infectious screen to make sure that the baby doesn't have any infection. Glucose screen. Remember I said they might do your glucose screen if you're gestational diabetic, and let's say especially you had insulin, something like that. Baby was small, baby was large. Sometimes they might do that. Bilirubin is a great indicator of hydration. So if the bilirubin is elevated, sometimes that can be an indicator of dehydration. The bilirubins for newborns are usually a little bit higher than the bilirubins for adults. So keep that in mind as well. If bilirubin levels are high, they can go into phototherapy treatments and things like that, which, I do have prenatal consultations that we go over all of these different tests, and if any of them are abnormal, what to do. So here's our case study, Marlene. So Marlene is GBS positive, and she saved her baby from a lot of unnecessary tests and treatments by knowing some things. So if someone was GBS positive, what would you tell them in terms of, like, let's say their water breaks? So we went over this a few times, but let's say you're GBS positive and your water breaks. What would you want to know if you're GBS positive, like in terms of complications for a baby, in terms of complications for extra tests, in terms of different treatments that you might have to have. So if we did talk about this a lot, but I'm talking about this also because it is very common, especially as a nurse. I'll notice this also, that sometimes we'll have a mom who's GBS positive. She did not know about stuff like as simple as we might have to do antibiotics before the baby's born, and then the baby had to have infection screens, which is more money, of course, and it's also more unnecessary tasks for your baby. And especially if you want to try to do as much skin to skin as possible in the beginning, having these extra tests sometimes can delay things. So at least if we don't need to do anything, it's always better. So who can tell me for GBS, some things to keep in mind? For group beta strep, if you're group beta strep positive, we were just talking about that. So for one, Marlene, GBS positive, I would say, okay, for one, if you're GBS positive, you would want to make sure that if your water breaks, you let your doctor know so that you can head to the hospital. You would want to make sure that you can try to get those antibiotics on board. And then if the baby were to come quickly for whatever reason, you would be in more likelihood of having your baby with certain infection screenings, and just to make sure that the baby does, is not sick or anything, they might have extra tests. Now we're going into the pain relief. Now I have a whole section, and then exactly, thank you, come to the hospital when the water breaks. That is exactly what I was looking for. Now for our next section is pain relief methods. I'm just going to talk a little bit about, each one, and then we're going to start going into the, postpartum and baby care. So pain relief methods, number one, really important. You should always start with Lamaze breathing. So I don't only think that you should know one specific pain relief method and go with that. I think that most people end up using a combination of methods. So it's good to know all the different options so that, you're not looking at one thing, it's not working for you. You're like, oh man, I don't know what to do now. So we have Lamaze breathing. You start out, usually one great Lamaze technique is you find a focal point. Let's say you find a clock, you find a spot on the wall, you find a focal point. Now you breathe in through your nose 3 counts, and then you breathe out through your mouth 3 counts. When you do that, so a lot Lamaze technique that they use is they try to focus on one body part per exercise. So let's say you're doing your 3 count in, your 3 count out. This time I'm going to try to focus on my arm. Let's say, I'm going to focus on my arm. You focus on your arm. It's kind of, that is going into gait theory. So gait theory is that's why I said it's good to have a combination of different pain relief methods. Gait theory basically says that your body can only take in a certain amount of stimulation at a time. So if you're concentrating on your breathing, you're concentrating on that body part, your body is not going to be able to have that extra stimulation to focus on the pain that is happening at other places in your body. So that is gait theory in combination with Lamaze. So that's why combination makes such a big difference. So when you're going through your labor pains, you would want to focus on your breathing. You would want to try to, focus on a body part at a time. Number 2, acupuncture, which focuses on pressure points. Acupuncture during labor is not necessarily poking you with a bunch of different things. Common misconception. Acupuncture also deals with pressure points. So as the pressure points actually are connected with different nerve endings and different portals in the body, like different even blood circulation and different things like that. So different pressure points can actually help you progress through pregnancy. You guys, I don't know if you've noticed this or not, but if you have a headache and you press through here, it helps with headaches and migraines. I'm not sure if you noticed that, but that is one of the pressure points. So same thing, how you can press here and it helps with headaches. You can press here and it actually can move your labor pains down. Another one is even here, you know, have you ever noticed how, ooh, it feels so good. You feel so clear. That releases tension. And some other pressure points as well, or different places that you can put pressure, like for example, right on your, well, this is not technically acupuncture, but it's kind of reverse pressure, is on the sacrum. So right on the sacrum, especially if you're having back labor, is you put some pressure on the sacrum, right where your backbone is, and that can help you with back pain and the, you know, back labor. So by putting pressure on different parts of the body, it helps to relieve the stress and therefore helps to relieve the labor pains that's going through all these different parts of the body. So those are just, you know, different tidbits. Water birth, the way that water birth works, just in case you're going in for a water birth, is that it relieves gravity and it allows you to move easier during your labor, because they think, you know, research also shows that, you know, if you can move, sometimes that can even move the, you can even have some hip movements. Hip movements help by helping the baby to move through the birth canal as well. So if you're using like one of those exercise balls and you do those little hip movements like that, sometimes it can help bring the baby down. Water birth kind of does the same thing. It helps to relieve the gravity. As for me, if I was going to have a water birth, probably not, but you know, everybody is different. So, you know, there's different benefits for each one, and it's important to know what each one does. Then there's hypnobirthing, which is the new thing right now. So hypnobirthing does not necessarily mean that you're sitting there like this going, as you're delivering your baby or laboring your baby. Hypnobirthing basically is based in the fact of meditations and focused affirmations during your pregnancy. So there's even little affirmation cards, you know, that you can say, you know, all right, you're doing your Lamaze, you're putting your pressure on different parts of the body. You might be, you know, moving or doing the ball, you know, then you might have your positive affirmations that you're getting from, you know, the hypnobirthing classes or whatever other resources you have. And those are positive affirmation cards, like, you know, my body was made for this, you know, I'm a great person, you know, I can't wait to meet my baby. You know, all of these are positive affirmations that you end up thinking to yourself as you are doing all these other things. Another pain relief method is gentle delayed pushing. So this is a pain relief method for the pushing itself, where instead of, you know, sometimes you'll be at 10 and they're like, all right, you know, you're at 10, you're ready to go. Instead of pushing exactly at 10, sometimes they'll say, okay, why don't you delay it for a little bit, if possible. And then when you really feel like you can go, then you can go to decrease the, and Yogi Birth is a good app for hypnobirthing. So that's great. Thank you so much for sharing that. So if you guys, you know, have any good apps or any other good tips or resources, that's what we're here for. You know, we can learn off of each other. So that's fantastic. Me, I love to see a wide variety of things. I'm the type of person that I'm like, all right, learn a little bit from here, learn a little bit from here, and, you know, and see how it goes that way. Then we have other pharmacological pain relief methods, which are pretty self-explanatory there. We have nitrous oxide, which is not used as much anymore, but that's the laughing gas. Local anesthesia, which is sometimes used as an anesthetic for lacerations or episiotomy. So sometimes, let's say before the baby comes out, if you're going to be having episiotomy, usually they do a local anesthetic with the episiotomy. We have IV pain medications as well, Demerol, Nubain. Those are short-lived medications that sometimes make you a little loopy, by the way. Epidurals are local nerve blocks. Usually it takes about 2 hours for that to leave your system and get your feeling back to your feet. Spinal anesthetic, that is similar to the nerve block of the epidural, except it lasts a lot longer, about 6 to 8 hours, and then you'll usually be out and about. Both of these do require catheters, unless you have a walking epidural, by the way. General anesthesia is usually reserved for emergencies. That's when they will do completely under, you know, they'll put you completely under as if it was an emergency situation and you did not have an epidural or you did not have any spinal in place. And let's say the baby's heart rate was dropping or there was some sort of emergency, they would go, okay, boom, let's, you know, we have an IV site, let's put her under general, let's put her completely under so that we can get the baby out for whatever reason. We try not to put people under general unless it's like, you know, last resort. And then we did talk about pain relief techniques a little bit. So I was able to progress through my labor a little bit quicker with my second one. Of course, you know, with your second, sometimes you do progress a little easier with your second, but also because I understood some more pain relief techniques. So one huge one for me was the pressure points. You know, if you put some pressure points on the sacral area and before you deliver, also I do prenatal classes privately that I can also go over more about pain relief techniques, more about what to expect, a whole bunch of great stuff. And this is my baby Nathan, by the way. I just wanted to put that as a note. Isn't he cute? He was so cute. His little hand out like there, like, let's go. But that's Nathan. He's 3 years old now. I'm like, these kids, they grow up so fast. So I want to give you guys like a little break. So if you guys want to have a little water, you can have some water. We'll go over postpartum care and newborn care for the second half of the class. It's really exciting. So what have you guys learned so far, you know, while we're taking a little water break, especially potty break, you know, if you guys are pregnant, I know it's probably peeing a lot, but I hope you guys like the class so far and you guys are learning a few things. I know that sometimes it can be overwhelming when, you know, you're pregnant or if it's your first baby and you don't know what to expect, but I hope that you guys are learning and that you are taking this and hopefully applying it to your specific goals. And then I do love to focus on postpartum care. I don't think it's enough just to talk about, you know, your labor and delivery, and then a lot of moms, they focus so much on their labor and delivery and then it's, you know, after and they're like, what do I do now? So you can focus on that. So hopefully you guys have a little water and we'll focus on a little postpartum care and then baby care. And then for those of you who don't know, on mommydidyouknow.com, that is my website. I have online classes that are self-paced. I have consultations. I have videos. You can also, if you have not subscribed yet, you can subscribe to my channel as well. On this YouTube channel, I also have video classes. I have video tutorials. I even have some videos like actually using pumps, how to use a breast pump, different tutorials on things like that. So I'm glad that you liked the different tests for the baby and what they're used for. I think, especially as a nurse, I normally work postpartum. So I find that so many people, they might be, you know, like, all right, take tests, or they're like, oh yeah, my baby's bilirubin was elevated or something, but they don't know what that means. So that's why I'm like, it's so important to know what all of these mean. I love education. So even as a nurse, like if you have me as a nurse, I talk more than all the other stuff, you know, like I love to just explain everything. So how to take care of yourself after delivery. So a lot of people, they will, here, let's, I can even open this a little bit. So you can see my face a little bit. Oops, I went. There we go. How to take care of yourself after delivery. So we have shakings, what to expect. And I know some people probably had a little bit of water, things like that. So we have shaking, contractions, mood swings, period-like bleeding. Those are all to be expected after you have a baby. So keep that in mind. Shaking, what can help with that are warm blankets, drinking water. That happens especially because your fluid is imbalanced. You know, you just lost a lot of fluid, and also your placenta was like a hormone factory. Then all of a sudden it's gone and you're like, boom, you know, what happened? Contractions happen after delivery as well. A lot of people don't realize that contractions are even stronger with each baby that you have. So let's say with your first baby, your contractions might not have been so strong. Your contractions will be stronger with each baby. And then they'll also be stronger as you are breastfeeding. So keep that in mind too. Mood swings, period-like bleeding, we call it lochia as nurses. So when we're checking your period-like bleeding, we're checking your lochia. We want to make sure that your bleeding is not too much. So if, like, let's say you change your pads and then about an hour later it comes out and it's saturated, that is considered heavy bleeding. So let's say you change your pad and then an hour later it's completely saturated, we're like, okay, that's heavy. 25% is like scant, 50% is like moderate, and then we'll say 75% and to up until 100 is pretty much heavy bleeding. Complications, hemorrhage, that's when you'll get clots like the size of your fist or bigger. Sometimes blood coagulates. So especially if you're in the bed for long periods of time, you might notice that your blood coagulates. Now that's normal. It's just, something that if it's small, not to be too concerned. However, if it's the size of your fist or bigger, definitely call your doctor. If you have all of a sudden you're filling out an entire pad, it's saturated, you would want to look that up. That's hemorrhage. High blood pressure after delivery as well can happen, especially as the hormone changes and all of the fluid that was circulating in that uterine space, in your uterus is all circulating throughout your body. So normally you would want to keep an eye on that as well. Sepsis is infection. So after you have a baby, you're at increased risk for yeast infections, UTIs, or even the baby as well. So sometimes you'll keep that in mind. If you had a rupture time that was very long, you would want to keep that in mind. For you also, if you had a cesarean birth, you would want to make sure that your incision doesn't have any signs of infection. So we have all these things. Depression, now difference between depression and baby blues. Depression gets in the way of daily life. Depression lasts longer as well. And then we have Giselle. So Giselle, she was one of my friends and she knew that I do a lot of postpartum care information and I help patients and I help parents. And she wanted to know how she can recover after 4th degree tear. So for those of you who don't know, a 4th degree goes basically from the vaginal area and cuts along through the rectum all the way across. It was repaired, but of course it is going to be very, very painful. In fact, some people say that they were in so much pain with that 4th degree tear that some people even get a section that second time around because they didn't want to have that same pain, because it would be, I've only had a first and it was painful. I can only imagine what a 4th degree will be like. So some different recommendations that I gave to her. One's a SIDS bath. So SIDS bath you can get on Amazon. It's very, very affordable price on Amazon. And it's kind of like a spa for your bottom. So it works really good. You can even, they sell different SIDS bath things that you can put inside to help with the pain. You can buy dermaplast spray, Tux pads. Those are very good for perineal pain, vaginal pain that you have. You can also make sure that you are changing your pads often. And then if you have something like a 4th degree, 3rd degree tear, you are at a higher risk for hemorrhage. You are at a higher risk for bleeding. So you would want to keep that in mind as well. Now, newborns. Now, this is the part everybody loves, is how do I take care of my baby? And this is my specialty as postpartum, by the way, as a postpartum nurse. This is my specialty because I spend most of my time with moms. I even do sometimes consultations postpartum just to help moms with their newborn care. They're like, all right, I just had my baby. What do I do now? So for postpartum care, normal newborn behavior. So what to expect once your baby is born. So normal behavior changes. For number one, the first hour or two, babies are normally very active. Then after that hour, they kind of hit a hibernation phase for about 12 to 24 hours. So for that active phase, it's great to get that skin to skin in. It's great to get that breastfeeding session in. Then when they hit that, 12 to 24 hours hibernation, that's when you want to try to wake them up to feed. Sometimes they're too tired, too sleepy to feed. So you want to try to wake them up and normally it's about 2 to 3 hours if you're breastfeeding and about 3 hours if you're formula feeding. If you're combination feeding, you would want to try to breastfeed first because breast is always perfect for the baby. And you want to make sure that the baby gets rapid stimulation, effective stimulation to the breast. So even if you were combination feeding, It's really important that you are doing the breast first, especially because babies tend to work the hardest in the beginning of their feed. And then, towards the end, that's when they start, calming down. So you would want to always do your meat and potatoes before you go to the dessert. So for breastfeeding, you want to make sure that you're skin to skin, that you're feeding frequently, that you're feeding on those early feeding cues, like the rooting, the hand to the mouth, the sucking, all of those different things. You don't want to wait until the baby's crying. If the baby's crying, usually it's too late. You want to calm the baby down and then put the baby to the breast. Normal newborns, they usually also have a lot of vernix. That's that cheesy, waxy substance that's over the skin. That vernix is actually a natural moisturizer for the skin. It's an insulator as well. So it keeps the baby's temperature warm. It keeps the baby's sugar regulated. So that is the basis behind delayed bathing. If you ever heard of delayed bathing, how they say, it's better to wait before giving the baby's bath. The main reason is because of the vernix, that's waxy substance that's over the skin. That creates that natural barrier, that natural insulator that locks in all of that temperature and everything for the baby. We also, normal newborns sometimes get a little rash. You don't want to do anything for a newborn rash unless it is very bad. Sometimes that rash might be something called petechiae. Which if they do say your baby has that, they might do an H&H for the baby to make sure the baby's not anemic, because sometimes it goes along with anemia. So that's to be expected with that. So the only thing with newborn rash is if it's really, really, really bad, they might end up ordering a hemoglobin and hematocrit to make sure the baby is not anemic. But like I said, that's usually if it's not just rash, if it's more petechiae, where it's kind of like red streaks rather than little rash dots. Noisy, and I should change the wording there from rapid breathing, but babies are very noisy when they're breathing, and they are a lot quicker. Their breaths per minute is a lot faster than an adult. So anyone type in, does anybody know normal breaths per minute for a newborn? Let's see how many people have had other prenatal classes. But this is one of the most important things to know as a mom. So if everybody can write down what you think is normal breathing rate for a newborn. So if your baby was a newborn, what would you think their breathing rate is? So I love to mention their breathing rate, because so many times I'll get calls from parents saying, my baby is breathing fast, what should I be doing? So that's why it's really important to know the baby's the breathing rate, breaths per minute. So for an adult, breaths per minute is about 16 to 18, sometimes less, sometimes a little more. I don't see anybody wrote in how many breaths per minute they think a baby has. And don't worry, I don't bite or anything. If I ask a question and you don't know the exact right answer, it's okay. But so you are very quick. You are very close with the 60 breaths. So normal breaths per minute is about 30 to 60 breaths per minute. If a newborn is breathing more than 60, that's called tachypnea. That is where the baby's breathing really fast. So if you see ever hear red flags, tachypnea. So that's why it's so important for you guys to know this, because I don't know how many times I've gotten calls from parents like, hey, my baby's breathing so fast. And I'm like, all right, how many breaths per minute is it? Or, I even will put them on the Zoom or something, and I look and the baby is completely content, pink, nothing wrong, and breathing like 40. And I'm like, oh, that's actually normal breaths per minute, So normal breaths per minute is 30 to 60, which is a lot different than an adult, which an adult is, if an adult's breathing 60 times per minute, you're like, oh man, what is going on here? But one red flag will be if it's over 60, or if it's below 30, of course, you definitely don't want that. Now, with red flags, I normally say 2 to 3 strikes, you're out. So if a baby just has one of these things, usually it's not really sign of emergency. But if it's, more than that, and then we're like, all right, something's going on here. So in terms of respiratory distress, infection, things like that, retractions, that's one thing I'm looking for. That is when your baby starts using its accessory muscles to breathe. So retractions are frightening also for a parent as well as a nurse, because it's all of a sudden you start seeing those accessory muscles working. If you have retractions and tachypnea, those are the big respiratory distress factors. We're like, all right, what is going on here? Some other things can be nasal flaring, where all of a sudden your nose, you'll start seeing the flares go up like this, your nose start going kind of in and out. Have you ever, it's almost like you're angry or something like, so that's nasal flaring. If you start seeing nasal flaring, you start seeing retractions, you start seeing tachypnea, even like the color changing, those are all signs of respiratory distress. So usually one of those is more intermittent. Let's say sometimes, especially if you have a premature baby, you might even see retractions and tachypnea, or even retractions or tachypnea after you finish feeding, because babies, they'll use a lot of their energy to digest their food, and especially if they're a premature baby. So fun fact, premature babies sometimes have retractions intermittently, or they might even have tachypnea after they finish eating. But if it continues after that, it's definitely like, all right, let's look into that. Some babies, red flag, if they're lethargic, that can be a sign of infection, fever, infection, sunken fontanelles. So how many breastfeeding moms are we gonna have today? Because breastfeeding is gonna be our next section as well. But how many breastfeeding moms do we have on here today? So I know we have quite a few moms. But so we have one big indicator of dehydration, by the way, is sunken fontanelles. So it's something that not a lot of people realize. So yeah, we definitely have a few people here. So one big indicator is a sunken fontanelle. So when you are breastfeeding, so all my breastfeeding moms who are currently, you know, like me, one huge thing I hear all the parents say is, I don't know if my baby's getting enough to eat. I can't measure it. You can't like put the baby on the breast and say, oh man, you know, I'm going to put the baby here and the baby ate, you know, 30 cc's. There's no indicator on the breast to say that the baby has eaten, but you have to look at yourself and you have to look at the baby yourself. You know, you can't really measure in the beginning. You don't really feel the difference in the beginning because your colostrum's already there. Like all of you guys right now that are pregnant, your colostrum's already starting to make its way, you know, inside your breasts. Now, what you're looking for are the baby's behaviors. Number one, you're looking, how's the diaper changes? You know, are diaper changes okay? Normally, a baby will have about 1 pee, 1 poop the first 24 hours, about 2 pees, 2 poops the second 24 hours, up until the, so for pees, it goes up until the day of life, by the way. So like, let's say pees, first day, you want 1. Second day, you want at least 2. Third day, you want at least 3, up until the 6th day. So that's one kind of thing of not a lot of people realize, but it goes by the days of life up until the 6th day. After that, you want at least 6 pees. If more, hey, that's great. But at least, you know, the day up until the day of life, at least we have our minimum. Poops, it goes up until the day of life until day 3. So we'll have, you know, 1 poop the first day, 2 poops the second day, 3 poops the third day, and then about 2 to 3 all the days following. So that's a great measure of hydration, great measure what you're taking in by how much you're taking out. So we have the diaper changes. We have the weight. Normally babies lose up to 7 to 10% of their weight the first week of life, but as long as they, you know, start regaining it back and they're not up to that, you know, that standard, that high mark. And then another one that a lot of people don't realize is the sunken fontanelle. If you're a soft spot, so there's an anterior fontanelle and a posterior fontanelle. Those are the soft spots, which by the way, are helping the baby to move down the vaginal canal. So some of the skull is not fused over with bone. Some of it's still cartilage. That's that soft spot. This closes about 1.5 years, and then the other one closes about 3 to 6 months. So babies that are dehydrated, their fontanelles sometimes will be sunken in, or even it might be even a little sunken in before you feed the baby. We already talked a little bit about GBS, but how to feed your baby according to personal choice. Now, this is a really, really important step. So I love to talk about breastfeeding here. So there's different feeding methods and everybody's different. I know that we have a lot of breastfeeding moms, and I just wanted to talk about, you know, a little of everything. So number one feeding method is direct breast milk, you know, direct breastfeeding. So if you want to have direct breastfeeding, one of the best ways you can do is after the baby's born, skin to skin. I'm a huge proponent of skin to skin. And let me tell you why. So do you remember how I was talking about how when babies are born, they don't shiver like adults. They metabolize their glucose. They start breaking down their sugar. Now, what happens if we have a baby who is, they're trying to regulate their sugar, they're trying to learn how to breathe, they're trying to do all of these things, and then they have to use all of their sugar that you're giving them to keep warm. Their sugar level is going to start dropping. Then they won't have the energy that they need for all these other processes just because they're trying to keep themselves warm. So what skin to skin does is it takes that restriction off of the baby, and instead it allows you to regulate their temperature for them. Therefore, it saves them all of their reserves. So if you think about it, babies, they don't have that much brown fat. They don't have as much reserves of fat. So whatever they do have, we have to try to conserve as much as possible. So anybody ever heard of the golden hour? I'm not sure if you guys ever heard of the golden hour, but some of you guys probably did. But what needs to happen in the golden hour, if you guys ever heard of it? But the golden hour is a very common term that is given to the first hour of life after delivery. Now, a lot of times they say, all right, in the golden hour, try to breastfeed and try to do skin to skin. Now, I'm going to tell you a technique. I saw some research about it, and it makes perfect sense. But so someone was like, all right, golden hour is basically, let's do skin to skin to help the baby transition for the first hour of life. Like, all right. And then I was thinking to myself, why are we only doing it for 1 hour? Because transition is a lot longer than 1 hour, isn't it? Transition is going to be for, days. So I'm like, let's do skin to skin as much as possible for the first few days. Now, skin to skin regulates temperature, regulates sugar. And there even was this research where they had twin babies on mommy. So they had premature babies. They had one baby on one side, one baby on the other side. And what they found was that each breast had a different temperature based on the temperature of the baby. So mom, your breast actually will be able to regulate the temperature of your baby just by being there, which is amazing to me. I'm like, that's fantastic. So by doing skin to skin, not only the first hour, like the golden hour, you probably heard of that golden hour scenario, but as much as possible, that first few days especially will really help you to be able to transition your baby. And then when you're giving your baby breast milk, so one of the biggest things, I wish I would be able to incorporate this in all of your guys' minds, is the importance of the latch. So literally like 90% of breastfeeding comes down to the latch and the positioning. If you have a good latch, your baby will be latching well, your baby will be hydrated, your baby will be stimulating your breasts, you'll have plenty of milk supply. So many times it just goes down to how your baby is latching. So make sure that when your baby's latching, you have a nice wide open with both lips flanged out. You want to make sure that the baby's belly to belly with you. And what you can do also is express some of your colostrum. You can hand express your colostrum, put it on the nose so that they can smell it. Open nice and wide, go down, and then the baby will be able to eat that way. So we have breast milk. Another, some people have donor milk, if that's part of what you want to do. If you do have donor milk, by the way, it is best to go through a recognized agency that does donor milk, or you can even think about donating your own milk for whatever reason. If you do donate your milk, they have different agencies. You can always email me for more information. I can send you some links over and things like that. But they have, it's like Milk Banks of America, and they have even different ones that are close to your city that you can always look into donor milk as well. There's also exclusive pumping, which is a new thing right now. A lot of people are exclusively pumping. It's just the basis with pumping is that instead of using the baby to stimulate, you're going to be using the pumping. Usually I'll recommend pumping if there's a separation between you and the baby. So let's say baby, God forbid, goes to NICU, or you are not stable to be able to breastfeed, or you have to be sent to, ICU, God forbid, something like that. Start pumping as soon as possible within like 1 to 6 hours. But for whatever reason, you have to be exclusively pumping. Make sure that every time the baby is eating, that you are doing a pumping session. So let's say the baby's eating every 2 to 3 hours, you would want to try to pump every 2 to 3 hours. I don't know why. Sometimes I'll have consults with people that they're like, my milk supply has gone down. I'm like, all right, how many times are you pumping? They're like, oh, about 4 times. I'm like, okay, and you're putting the baby to the breast tube? No, I'm just doing the pumping. Like, all right, and how many times is the baby eating? They're like, about 8 times. I'm like, all right, so you're making half as much as the baby. So in those 4 pumping sessions, you're making half as much as the baby's eating, right? She's like, yeah. Like, yeah, that's because you're pumping half as many times as the baby's eating, so it all goes with that. If your body would not necessarily know about the stimulation unless you're stimulating it. Now, some direct, some expressed. That's for, like, let's say you need to supplement. Let's say the baby's jaundice, the baby's bilirubin is high, the sugar is low, the baby's not gaining weight, or you have concerns about something. You are tongue-tied, is giving you a restriction for the breastfeeding, something like that. You might need to supplement a little bit. The first supplement that you should always go to is your own expressed milk. Your own expressed milk is not available, maybe you can have a donor milk. If your donor milk is not available, then you can go to the formula if need be, unless, of course, that is your decision. And then there's also all formula. If you're all formula, keep in mind that your milk will still come in. So you have to still plan for engorgement, still plan for mastitis to prevent it. You would want to have a cold packs, well-supported bra, try not to have an underwire, anti-inflammatories as prescribed by your doctor as well for engorgement, things like that. So we have Marcha. So here's case study, more than anything, just a tidbit about mom shaming a little bit. So I, of course, am, all for breastfeeding. There's so many great benefits of breastfeeding. It's like a direct antibiotic, it's specific for the baby. It lines the intestines, it lines the stomach. However, for whatever reason, sometimes people are not able to exclusively breastfeed. And I just wanted to say that me or, nobody will be ever pressuring somebody to breastfeed when they don't want to or they cannot. So I never want you guys to feel guilty or shamed if you do not have the ability to directly breastfeed or you don't have the ability to completely breastfeed. It's never something to feel guilty about, and it's not something that makes somebody any less than, a mom, because you're a mom, and in the end, even that you're here, you're watching this, that means that you care about your children, you care about the health of your baby. So I never want anyone to feel judged or, any depression or rejected for their feeding choices. So that was my little tidbit there. And I hope you guys can appreciate that. So I hope that everybody liked this past hour. And I just wanted to share a little package that I made for you guys. So as you know, I do have consultations. I am a lactation nurse, and I help people not only with lactation, but also with prenatal care. And one thing that I found out is that when you start your prenatal education, when you start your lactation education, even while you're pregnant, prenatally, it really can help save you time, it saves you money, it saves you heartache. And for me, I'm like, man, with my first baby, I could have saved so much money if I had prenatal education before I had my baby. And you don't have to buy the formula, you don't have to buy the breast pads, you don't have to buy all of that extra stuff, or even in terms of treatments and tests that you could avoid. I could have avoided an entire week of phototherapy for my baby. I could have avoided a whole bunch of perineal pain that I didn't know about. It could have avoided a lot of pain during my labor. So all those things with prenatal education. So I have this special package that I want to share with you guys. That's the Childbirth Masterclass Prenatal Package. So it's a Childbirth Mastery Prenatal Package. It includes, and you guys are actually going to have a special bonus just because you guys are here with me right now. But number one is it features prenatal coaching. So I think that it's really important to start now, because those first few hours are crucial. And I have special steps that can help you after you have your baby to know exactly what to do when your baby is delivered to put you on the best possible track for both you, postpartum care wise, recovery wise, and the baby. So you get 2 hours of private prenatal classes. And what's really cool is that you can actually invite your friends and family. So let's say you're getting those 2 hours of prenatal classes and you're like, hey, I want my mom to join. I want grandma to join, because I do go over infant CPR. I do go over milk storage. I go over how to take care of a baby, how to swaddle a baby. We go over baby care in those classes. I go over how to support you during your labor. I go over exactly where to have the pressure points and all of that. So it's great for that, because we can have those private lessons. You have digital downloads of all the Zoom visits. So let's say you have it now and you're going to deliver in a week and a half from now. You can always have the visit with me now, and then a week and a half before you go in. I remember someone said they had an induction. You can, watch it while you're in labor, and you're like, oh yeah, there was this section about labor management. What did she say about that? Oh yeah, let me open it up and see. You can access the notes, appointments, and handouts in my portal. So I'm very techie, so in case you haven't noticed, but I actually have a patient portal as well that you can access all of your appointments. I have handouts, digital handouts that I can give to you guys. And then I am huge on making sure my patients are educated. So in addition to all of the prenatal, those 2 live prenatal visits, you also get 1 month of courses. So this is actually unlimited. It's lifetime access to these courses, but it's 1 month of self-paced lessons. So it has like 26 lessons altogether, or days of lessons. It has 8 hours of videos. It has a breastfeeding class, a childbirth prep class, has a baby care class. It has like 40 hours of content, whole bunch of articles, and it even has a test and review with explanations. Because how many times you do a test and you're like, oh man, what was the explanation? Why? So it has all those explanations. And then I wrote 3 books. So I literally wrote the book on breastfeeding and I have 3 textbooks here that you'll be able to download and you can bring with you wherever you go. So you get the prenatal visits, you'll get those online courses, which with over 40 hours of content that you can access anywhere you go. You get those digital downloads. And then for a bonus, so remember how we said you guys have bonuses, being that you guys are on the live class, you'll have a toolkit as well, which is 20 digital cheat sheets to help you during your childbirth. So I have some hypnobirthing affirmations. I have 9 pain relief pressure points. I have a whole bunch of breastfeeding cheat sheets, a Lamaze breathing guide with even additional different practice exercises, CDC developmental guidelines so that you can kind of remember, okay, this is what's to be expected by the baby's 2 month. This is by 4 month. We have essential oil uses during pregnancy and labor, CPR, infant massage, which infant massage can help you with gas, colic, breastfeeding, and even exercises that you can do prenatally and postpartum. And then as another bonus, you'll also have a 1-hour consultation after the baby is born. So this is just for people that are watching this class right now. You'll be able to have the bonus 1, which is the childbirth toolkit. You'll also have the postpartum consultation. So for all of that, we'll have the prenatal coaching, you'll have the course access, you'll have the digital downloads, you'll have the postpartum consultation, the childbirth mastery toolkit, which is, a lot of value. It's over $600. But if you think about it, it's like just even the price of that you're going to save by not having those issues in pregnancy, not having those issues in the labor, not having, hopefully maybe you can even go natural. If you go natural, hey, that's like a $1,200 savings right there, or even if you have the epidural, but you can save yourself some heartbreak with breastfeeding, that's going to save you over $1,000 on formula for the year. It's going to save you on breast pads, and also breastfeeding babies tend to get sick less, by the way. So that's less time you're missed from work. That's more time you're going to be able to spend with your baby, less trips to the doctor's visit. So easily all of those things can be thousands of dollars. But the good news is that this package is only $150. So what I'm doing is I'm doing the prenatal consultations, I'm doing the online class, and isn't this great? It's great stuff. So I'm doing the prenatal consultations, the online class, the digital workbooks. You're getting the the toolkit, you're getting the postpartum consultation. So that's 3 hours of private lessons over 1 month of online classes. And it's literally $150. So it's perfect. The way that you can sign up is by going to mommydidyouknow.com. You know, maybe I can even show you as well, but you can go to mommydidyouknow.com under consultations and you'll see it, or you can send, the best way really is just to send me an email. So if you want to have this special package, the $150 childbirth mastery class, all you have to do is send me an email, and I'll write it here too. gmail.com. So all you have to do, if you want the special one, just because this is going to be a special package that I have for you guys, all you have to do is go email mommydidyouknow@gmail.com and say, hey, I was in your childbirth class and I would really want the childbirth mastery coaching package, or, you know, I want the package you were talking about today. So that's $150. But in order to do this package with the bonus toolkit and the bonus postpartum consultation, you would have to try to do that within the next 24 hours or so. Otherwise, you know, it will no longer be active for that benefit. So we have all of that good stuff. You'll just email me for that. And then I did mention that I'm having a giveaway. So for the giveaway, and I hope you guys are learning so far, and I hope you guys have enjoyed this class. So my giveaway is actually going to be my free childbirth masterclass. So that's going to be actually 2 premium courses now, my childbirth class, as well as my breastfeeding class. So each of those are 2 weeks long, and I'm going to be giving somebody those classes for free. Yay, I hope you guys love it. But it's 1 month of classes that you'll be getting for free. Now, the way we're going to do that is I want everybody to think of a number from 1 through 10 and write it down on the chat box. So if you guys just write down a number 1 through 10, and you can do that now. And then I hope you guys liked the class so far. And I really hope to be able to connect with you guys and partner with you. Remember, if you want the special package, which is a big discount than what I normally charge, which is the $150, the only thing you have to do is email mommydidyouknow@gmail.com, and I will be able to get you started with that. So just say mommydidyouknow@gmail.com. Say, I want to sign up for your package, all right, that you talked about. So we have a winner, and the winner is Marlene. Yay! So I see a few other people, but the winner is Marlene because she picked my lucky number. So Marlene, what you can do is you won both of my classes. You can just email me at mommydidyouknow. Oh, well, now we have another 7. I'll give you both because fair is fair. I'll give you both. I guess it's Acacia. I'm not sure how to pronounce your name, but you won as well. So I will give both of you guys the access to the premium courses. So congrats, you guys. I hope you guys love it. So, well, now I already announced those 2. So those were the first 2 that got it anyways. So Acacia and Marlene, you guys won. So what you're going to do to access the course is simply email me at mommydidyouknow@gmail.com, say that you are the giveaway winner. All right. Just because I don't want to give links, because then everybody will have the link for the free course. So just email me mommydidyouknow@gmail.com for Acacia and Marlene. Congratulations. Say, hey, I was the giveaway winner and I just wanted to get access to the free courses. And then I'll send you the link that is directly to be able to sign up for free. The rest of you can also email me to get the coaching package. You can also go to mommydidyouknow@gmail.com. mommydidyouknow.com, and you can sign up for all of the wonderful resources that I have. Make sure that you subscribe as well, because I have some really great videos. So just as a goodbye, I just want to see what everybody's favorite section of this course was. So something that you thought was most helpful or even more eye-opening for you guys, just so that I know, what to focus on, what you guys really enjoyed. So what was your favorite part of this course while I am saying goodbye to everybody? And I really hope that you guys all enjoyed it as well. And make sure that you can also still talk to me too if you have any questions. So testing and red flags for newborns, that's so true, because a lot of times people, they don't really know what to look out for in terms of emergency situations for their babies, or they don't know what to do if there are emergencies. So it's really good. And especially at least with the package too, I go over CPR, I go over more into respiratory distress, I go into, because I also work NICU, so I go into what to expect if your baby is admitted to the NICU. And then Jasmine said labor. Yes, even especially going over the difference between labor, like true labor, false labor, how to progress through it, pain management. Perfect. Yeah. And I have a whole breastfeeding section, by the way, Acacia, just in case. Sorry if I'm pronouncing it wrong, but I have a whole section on breastfeeding on the YouTube channel too. It's like a whole playlist. And red flags is so important. I know that sometimes you want things to go perfectly, but sometimes they don't. And that's okay. We'll kind of just play by ear and work with whatever is thrown our way. Oh, that's really cool. So you taken over 5 childbirth classes and none went over testing. So I really appreciated that. Well, I mean, it's true, because I'm also a postpartum nurse. So I work a majority of the time what I'm doing are postpartum testing, prenatal testing. And then I find that a lot of people, that's the most, I guess, thing that they don't really look into are tests and what to do if tests are not exactly according to plan, and what to do if like the bilirubin goes high or if the sugar is low, things like that, what to expect. So it's really nice. So I'm glad that you guys appreciated that. So if you guys have any other questions, you can always let me know. I'll be more than happy to answer your questions, anything that you have. And also, you guys do have free 15-minute consultation as well for watching this video and staying until the end. To do that, if you go to mommydidyouknow.com, consults, and book a consult, there's one of the options is free consultation, or like a free I think it's a free visit, something like that. You guys can also sign up for a free visit. We can talk more. That one's just like a 15-minute review. If you wanted to go over a question or something specifically, you can always ask me as well. So I enjoyed this. I hope that you guys did too. And please stay connected and let me know if you have any questions. All right.